If you go to Darwin, Perth, like jobs are like so many, even in Melbourne as well.
बहुत सारे स्टूडेंट थिंक दैट के इंटरिम सर्टिफिकेट पे जॉब मिल जाएगा क्या इंडिया से, तो वो थोड़ा डिफिकल्ट रहता है.
And in that, they have said the eligibility certificates, and then they will check the eligibility documents. And later on,
But if you are in overseas, so a little bit difficult to get a job. You need to pass the exam.
but these days they have changed the criteria that even if you fail in clinicals, you can still go for clinicals. You don't need to go for written.
So hello everyone, welcome to Academically. Today we are going to discuss with Prachi. She is one of the lecturer at Academically, and she is a registered physiotherapist in Australia. We'll know her about her journey, and also how you can pass the exam if you want to practice in Australia. So the part one exam or part two exam, all those things we will talk to Prachi. Hi Prachi.
Hello, Akram. Thanks to invite me here.
Thank you. So, Prachi, if you can just give us, your brief intro about yourself, from where you did your free therapy education and so far your experience.
Yeah, so I have completed my graduation and post-graduation from Pune, Maharashtra University of Health Science.
Okay.
I did my master's in musculoskeletal sciences.
Okay.
And then I worked there as a lecturer, and then I became an associate professor in Pune itself. So I
Okay.
worked almost for around 5 years,
Okay.
and then decided to move to Australia. And then in 2018, I moved to Australia for a better future. Yeah.
Okay. So once you move here, how you know about this process and all those things?
Yeah, so when I was in India doing the process of immigration, that time I just inquired what is the process and scope for physiotherapy.
Okay.
So some of my colleague and other people, seniors, they have said that we have to go through the exam, and we have to go through clinical exam, written exam, and there are so many different processes. So I started gathering information. They have directed me towards their guidelines and website as well. So AFRA website and APC guidelines and all that stuff. So I
Yeah.
started gathering information. What is the exam process? Later on, when I came to Australia, I have enrolled myself with the APC, and just started with the portal and then started reading.
Okay.
And then you're just like reading the books and all that stuff.
Okay. Okay. So if you can just give us, what are the steps they need to take any overseas qualified physiotherapist looking to migrate to Australia? Like first step, like for example, interim certificate.
Yeah, so there are two things. If you want to straight away give the exams, that is a different journey. And if you want to, start working under supervision, then you need interim certificate and all.
Yeah.
But if you want to give just exam, if you are in overseas and you can't come, so you can do examination. So you have to enroll yourself, make an account with the APC, and in that they have said the eligibility certificates, and then they will check the eligibility documents. And later on, we have our clinical exam, written examination and clinical examination. And in that portal, it is given in detail what are the topics you have to do, how is the marking system, how much weightage is given for individual topics. Accordingly, you have to prepare yourself.
But for you, no need to worry. Academically is here, so we are going to assist you in your journey in documentation process. We'll provide you the coaching for this exam, so we'll make your journey very easy. No need to
Yeah.
worry. But she discovered a lot of things because as a candidate, if there is no company and no one is there to assist you, so this difficult. There is a lot of guidelines you need to read here and there, but we already figure out all those things, so no need to worry about all those things. So first step is actually the interim certificate. But if you are in overseas, so little bit difficult to get a job. You need to pass the exam, then you get a high chance to get a job in Australia. And so if you can just give us this part one exam, what are the subject they cover? It is an easy exam or tough? How you rate this as a lecturer or as a student?
Um, because I was a lecturer, so I always like to read and all that stuff. So yes, when it comes to books, and again you have to start from for year first till year final, it is really, you feel like, oh God, again. But yeah, you need to figure out that how many months you have to give for particular subjects. And There are different topics like musculoskeletal sciences, then you have neurosciences, and then you have cardiovascular, respiratory conditions, and then evidence based. Plus, there is an ethics based question. So there are like different sections. So you have to first figure out that, okay, I need to complete all the MSK or neuro one by one and give few months accordingly, and then you just judge yourself that if this is the case, what I will do in that case scenario. So you have to figure out how much time you need, but basically you need to read all the whatever given books or journals or articles, and that's how update your knowledge what is currently going on, because I studied 10 years ago
Hmm.
and now it's like all outdated. So you need to read the recent articles.
It's an article. Recent, yeah. So we are providing the recent, based on the recent, basically the syllabus from APC. No need to worry. So academically is here to assist you on your journey. So if you can just give us, especially in the part टू एग्जाम, बहुत सारे स्टूडेंट को लगता है यार पार्ट टू एग्जाम बहुत टफ एग्जाम है, हम पास नहीं कर पाएंगे, इंडियन इंडियन फ्यूचर पे पास नहीं कर पाते हैं. तो आपका क्या एक्सपीरियंस रहा, एंड सो फार आपने इतने टाइम में बहुत सारे बच्चों को गाइड भी किया हुआ है. तो आप ये पार्ट टू एग्जाम का क्या है कि इजी एग्जाम है, ये टफ एग्जाम है और मीडियोकर एग्जाम है ये?
um I think you should not take any exam like an easy, because that's the only one chance you get. Nowadays, like in my time, it was only one chance and then you are gone back to return. But these days, they have changed the criteria that even if you fail in clinicals, you can still go for clinicals. You don't need to go for written.
Yes.
So that stress is gone. But still, exam is exam. You are giving your hard work to one exam. So you can't just go and say that I will do it. So better read all the scenarios, read their marking criterias, and whenever you get the topic, first go through all the details, how things go, how they work, and then accordingly make your own template and prepare every topic, like every case scenario. Like for example, for MSK, full knee joint, then what all things can come in knee joint, then hip joint, what all things can come. So make your own templates or make your own sort of notes and then prepare according for the clinical. But overall, yes, we need a thorough knowledge, because patient can be anyone. You won't be
Yes.
having books that time.
Yes. So I can say it is like a mediocre exam. If you study well, concept are clear, definitely you can clear the exam.
Yes,
Okay.
definitely.
Yeah. And what is this exam? Like the job, basically, as you mentioned that supervised training or जॉब कर सकते हैं वो जिसने अगर इंटरिम सर्टिफिकेट कर लिया या पार्ट वन पास कर लिया है, दे आर इन इंडिया लुकिंग ए जॉब. तो वो जॉब मतलब क्या इन जनरल मिलती है या बहुत ही कम जॉब होती है? मतलब इन जनरल क्या रीजनल एरिया में ज्यादा जॉब्स होती हैं? कहाँ पर ऑस्ट्रेलिया में ऐसे जॉब्स ज्यादा हैं?
So jobs का ऐसे है that you can apply if you have a visa, or if you are, if somebody is ready to sponsor you, then you can get that job. But if you are back home in India, and though even you have interim certificate but nobody is there to sponsor you, then getting that job will be a bit difficult, because no company wants that, all the visa money charges and all that stuff. But yes, there are some jobs available where the employer wants to sponsor you, and they will provide the induction, they will provide you the training, and you will be under supervision. There will be one supervisor, but it's not like all the time with you, but there will be one supervisor guiding you and will be there for you always.
सो आई कैन से इन जनरल के आप जो रीजनल एरिया होते हैं वहाँ पे अपॉर्चुनिटी ज़्यादा हो सकती है कंपेयर टू सिटीज़ में. और बहुत सारी कंपनीज रेडी टू स्पॉन्सर द वीज़ा, लाइक 482 वीज़ा. एक साल एक्सपीरियंस होना चाहिए आपको फिजियोथेरेपी के बाद. और 494 वीज़ा में भी 3 years यू हैव वर्क एक्सपीरियंस, इन दैट केस यू कैन माइग्रेट. बट if you are in Australia, then obviously there's a high chance to get a job. And if you are in India, even you can come on like a study visa, and then you can start your process. So there is a lot of ways, you can think. तो अगर आपको एक्सपीरियंस है इंडिया में तो डेफिनेटली ज़्यादा चांस रहेगा आपको जॉब भी मिल जाएगा. अगर जीरो एक्सपीरियंस है तो ऑब्वियसली आपको लो चांस रहेगा. एम्प्लॉयर भी देखेगा थोड़ा सा कि भाई उनको एक्सपीरियंस वाला बंदा मिल जाए एग्जाम पास करने का. पर इन जनरल अगर आपने दोनों एग्जाम पास कर ली, बड़ी गुड चांस, हाई चांस टू गेट ए जॉब. तो जितना आप एग्जाम पास करते जाएंगे इतने ही आपको चांस बढ़ते जाएंगे. तो बहुत सारे स्टूडेंट थिंक दैट के इंटरिम सर्टिफिकेट पे जॉब मिल जाएगा क्या इंडिया से, तो वो थोड़ा सा डिफिकल्ट रहता है. बिकॉज अभी आपने कोई एग्जाम भी पास नहीं किया है, एम्प्लॉयर भी नो यहाँ पर, तो दे प्रेफरेंस गिव दो आर द लोकल हैं, या लोकल यहाँ ऑलरेडी ऑस्ट्रेलिया में आ गए हैं, कोई दूसरे वीजा पे हैं, तो उन लोग को ज़्यादा प्रेफरेंस मिलती है फिजियोथेरेपी के अंदर। और जॉब्स इन जनरल जो है, एज केयर में बहुत सारा जॉब्स है, फिजियो क्लिनिक्स भी होती है, वहाँ भी आप वर्क, तो हॉस्पिटल्स में भी आप वर्क कर सकते हो, तो जॉब का तो इतना प्रॉब्लम नहीं है, आई थिंक। वो वर्ष 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 एक्सपीरियंस क्या चाहिए, जॉब का इतना प्रॉब्लम है क्या, मिल जा रही है?
नहीं, जॉब्स तो मिलती है। जॉब्स का डेफिनेटली नॉट अ प्रॉब्लम बिकॉज ऑस्ट्रेलिया इज अ बिग कंट्री एंड जॉब्स आर एवरीवेयर. लाइक आई एम इन मेलबर्न, बट इफ यू गो टू डार्विन, पर्थ, like jobs are like so many, even in Melbourne as well.
Yes,
So job point of view, there is no problem, and even the salary point of view, there is, like, for a fresher, it is really a good start.
yes. So we can say if you are a physiotherapist looking to migrate to Australia, so you can visit academically.com and we can help you further. So अच्छा, कुछ पीआर भी बहुत सारे बच्चे पूछते हैं, पीआर कैसे अप्लाई कर सकते हैं? इफ यू कैन पास बोथ एग्जाम, you will get general registration. Then you need to apply APC for skill assessment. You need to get letter, and once you got that letter, you need to apply EOI and visa. So easy process है, इतना नहीं, बस मेन ये है कि आपको दोनों एग्जाम पास करने हैं। और ये जो इंटरिम सर्टिफिकेट आप अपने घर से कर सकते हो, इंडिया से, और जो पार्ट 1 MCQ एग्जाम है ये भी आप वहीं से पास कर सकते हो। क्लिनिकल वाला आपको ऑस्ट्रेलिया में आके देना पड़ेगा।
Yes.
तो Prachi, anything you want to say at the end?
I just want to say that yes, students are really hardworking, and they have seen that vision from this age. Where my time I was like, no, bas yahi karna hai India mein. But I feel these days students are very active. They are doing good, and yeah, it's really good to support and help them. So I'm looking forward to it.
Yeah, thank you, Prachi.
Thank you.